Okay, everyone, we will get started here. My name is Stacey Dawes, and I'm the Health and Community Engagement Lead at Family Caregivers at BC. At FCBC, we are passionate about creating awareness on caregiver-friendly healthcare, and we are here today to support you in your learning on how you can be an ally in that. I'd like to recognize that I'm joining you today from the traditional, ancestral, and unceded territories of the Kutsi, Coquitlam, Musqueam, and Squamish, and Tsleil-Waututh First Nations, and home of the North Fraser Métis Association. With us today is James Janeiro, Director of Policy and Government Relations from the Canadian Centre for Caregiver Excellence. James is a public policy and advocacy professional with over a decade of experience in politics, policy, and government relations. And as the Director of Policy and Government Relations at the Canadian Centre for Caregiver Excellence, James leads an ambitious national and pan-Canadian advocacy and policy development agenda focused on substantive, oh my goodness, and practical reform. I think I need some water. In today's webinar, A Brighter Future of Care Towards National Caregiving Strategy for Canada, we will be working with you and educating you on how he has engaged with caregivers and care providers and researchers, regulators, health and social care leaders, and labor to develop a national caregiver strategy aimed at making Canada the best place in the world to give and receive care. And in today's session, James will share the process that was developed to create the strategy and discussing key elements of the strategy and advising on pathways towards impactful implementation. And I will pass it on over to you, James. Thank you for being here.
Thank you very much, everyone. Appreciate the opportunity to be with you and spend some time with you. Joining from Toronto. So it's a cold and windy, bright day here in Toronto, but nice to see so many people from across the country. As you heard just now, I will be talking to you a little bit about our work at the Canadian Centre for Caregiving Excellence. I'm going to try to zip through this as quickly as possible to leave plenty of time for questions at the end. But if it does work with folks at Family Caregivers BC, I can share the slide deck with you all fine folks after the fact, and you can spend some more time going through it, and then get in touch with me separately if you have any questions after we chat. So why don't we jump right in? A little bit about us at CCCE, the Canadian Centre for Caregiving Excellence. We are embedded within the Azrieli Foundation, which is the largest non-corporate foundation in Canada. And our mission is to make Canada the best place in the world to give and receive care. We see Canada leading the way in quality care, where caregiving is valued, caregivers are supported, and people accessing care are central to policies and practices. We do this through a bunch of different things. We are a funder, so because we have a very generous foundation backer behind us, we are able to fund all sorts of work. We fund research, we fund policy interventions, we fund program interventions, and we fund scaling up of interventions from one part of the country to another. So we do that sort of thing. We're a convener. We try to break down the silos between disability, healthcare, aging, illness, mental health, addictions, and so on. We also try to break down the silos between the different age groups within the caregiving universe. For us, caregiving happens at all stages of life and can come about for any sorts of reasons. So whether you're providing care for a child with a disability or some sort of mental health challenge, all the way up to supporting an aging parent near the end of life. To us, if you fall anywhere within that spectrum, regardless of, again, aging, disability, illness, mental health, addiction, and so on, whatever it might be, you're a caregiver if you're providing care for somebody else in your life. We're also pretty unique as an organization, excuse me, because we're the only ones in the country to, number one, take such an expansive definition of caregiving, but also we intentionally talk about both caregivers and care providers in the same breath. A caregiver would be somebody who is unpaid, family, friend, brother, sister, neighbor, cousin, whatever it might be, but somebody who provides care not for remuneration. We also talk about care providers, which is the catch-all term that we use for people who do this for a living. They're called different things across the country, but say a personal support worker working in a long-term care home or doing home care work, or a direct support professional who supports kids and adults with disabilities, and so on and so forth. So again, we take a pretty expansive definition in that regard as well to try to capture as many people as possible who do this sort of care work for a living. I'll also say that in addition to being a funder and a convener, we're also an advocacy and public policy organization. That's the part of our work that I focus on as our Director of Policy and Government Relations. Our vision, like I said earlier, is to make Canada the best place in the world to give and receive care. A large part of that is advocating for and doing the work around really ambitious, sustainable, and impactful public policy reforms that will achieve that goal of making Canada the best place in the world to give and receive care. So I spend most of my professional life developing policy in collaboration with folks like everyone here joining our webinar today, as well as leaders from organizations across the country, caregivers, care providers, people with lived experience of all sorts, researchers, academics, and so on, but also taking those ideas to the halls of power to actually trying to move the needle on these issues and achieve concrete, specific public policy reform. Now, we've been advocating for a national caregiving strategy from the very beginning. We're just about 2.5 years old, and we've been beating this drum for some time. Why do we feel a national caregiving strategy is important? Well, for starters, caregivers and care providers are the backbone of Canadian society. Anyone who is in the healthcare space, I'm sure, experiences this on a daily basis, where you're providing care to a person who needs help, and alongside them, behind them, sitting with them, whatever the situation might be, is some sort of caregiver who is a pretty key, critical success factor in whether that person does well or doesn't, both in their healthcare situation, but also after they leave your care and exit out into the community. The numbers are pretty staggering. 1 in 4 Canadians is a caregiver today, and half of all Canadians will be a caregiver at some point in their lives. I just want to underline that one more time. 1 in 4 of all Canadians today is a caregiver already in January 2025. This is before the lion's share of the baby boom really reaches those critical care needing years post-retirement, closer to the end of life. Already today, we're seeing this figure of 1 in 4, eventually 1 in 2. And if you're a woman in Canada, you're already 50% as likely as not to be a caregiver already. So this very much is a ticking time bomb that's just below the surface that requires all of us to work together to really address this as the public policy issue that it is. The mental, physical, and financial health of caregivers is suffering. You don't see numbers like this without seeing some sort of impact on society. 80% of caregivers tell us that they're feeling isolated. 75% tell us that their mental health has suffered as a result of their care responsibilities, and half say that their physical or the financial health has suffered as a result of caregiving. For every 3 hours of care provided, or there are 3 hours of care provided by caregivers, for every 1 hour provided by the healthcare system, the work you find folks all do in healthcare settings across the country, that is so critically important to the well-being of every Canadian from coast to coast to coast. But for every hour of that care, there are 3 more being provided outside those healthcare settings, in communities, in homes, in long-term care homes, in group homes, in various sorts of places that are outside of the formal healthcare system as we generally understand it. This is an unsustainable ratio. This is a lot of work for too few people to do in Canada today. We're also leaving about 1.3 billion in lost productivity on the table because of caregivers having to make the frankly choiceless choice to work less as a result of their care responsibilities in order to provide care to the people in their lives. Now, not working, that hurts us individually. It makes it harder to put food on the table, to pay the rent, pay the mortgage, do all that sort of stuff. But it also hurts all of us collectively, again, to the tune of almost $1.5 billion in lost productivity at a time when we're all suffering from slow, verging on stagnant economic growth for want of productivity increases across the country. Lastly, on the care provider side, we're already experiencing a workforce today, and that's set to improve, to get worse as time goes on. 80% of care providers have told us that they have considered leaving the profession within the last year, in large part because of insufficient wages and poor conditions of work. And here's a fun fact for you. In Alberta alone, the demand for home care is set to double over the next 7 years. And there is no plan that I know of to double the capacity of the care provider workforce over that 7 year life or 7 year time horizon. So this is a problem today that's only set to become worse if we do not tackle this problem in a concrete, strategic, and intentional way. In short, the Canada we deserve isn't possible without caregivers and care providers, and they need our help. In order to meet this challenge, we need urgent federal action to shore up caregivers and care providers so they can keep doing what we all need them to do. I'm going to say right off the bat here, before going any further, that we are living through interesting times when it comes to politics in Canada. We have been calling on the federal government to make this move for quite some time. And in budget 2024, which was April of 2024, Minister Chrystia Freeland, then Minister of Finance, stood up and presented her budget, which included a commitment to a national caregiving strategy, as well as getting off the table or getting off the ground a sector table on the care economy. We're now coming up on a year since then, and I'd be lying to you if I was dramatically impressed by their progress on this front. I'm not, and I tell them that on a regular basis, including twice today. And this has only been made a little bit more complicated by the realities of where we are. In the federal electoral calendar, with a change in leadership happening as we speak, and likely a federal election sooner rather than later. So I just want to put out there that everything that I say today is within that context. We have been working at this for some time, and part of what we do, part of what I do, is ride these shoals as they come, meet the moment, and try to take advantage of every opportunity that we can to try to move the needle here. Now, the timing, frankly, is not great because we have spent the last year developing a national caregiving strategy through consultations and discussions with, there we go, with leaders and care providers and caregivers and sectoral champions and researchers and academics from coast to coast to coast. I won't go too long on this because we are already approaching the time when I'll turn it over to questions, but it has been over a year worth of conversations like these happening in every part of the country. I'll highlight a couple key components here for you. We convened a care champions table of leaders and representatives that represent the full diversity of the sector, as well as the geographical diversity of our fine country, to really kick the tires on specific policy proposals as they arise. In addition to doing that, I and my colleague Liv, our executive director, spent really most of the year crisscrossing the country, both online and in person, to attend meetings, conferences, gatherings, other convenings, and have conversations with people where the rubber hits the road on what people want to see in a national caregiving strategy. We have spent the last year speaking to literally thousands of people in literally hundreds of fora in every part of the country. You name a part of Canada, we were there, either online and in person, often both actually, to try to make sure that these conversations and this process around what should be included in a national caregiving strategy was truly reflective of the realities that we're all living today. I'll also say that we started this process of developing our strategy well before the federal government made their commitment to developing a national caregiving strategy. So we've been working very closely with the feds ever since they made their commitment for all of this work that I'm talking to you about today, to be the key input into what the feds decide vis-a-vis the national caregiving strategy. With the caveat, of course, like I said just a few moments ago, that the world today is infinitely more complicated when it comes to this stuff than it was even 2 months ago because of where we are in the electoral cycle. Now, I'm going to very quickly zip through just the 4 key areas of policy that we've been working on to leave plenty of time for questions. I'll leave this up for a second so that you can read it. But one of the key areas we were looking at is specifically around healthcare. What can we do in the realm of healthcare in the federal domain that would have an impact on caregivers specifically in a very tangible, practical way? We talked about access to clinical training, making caregiving a priority for future federal, provincial healthcare funding agreements, dedicated access to mental health supports for caregivers, as well as dramatic increases in both the amount and the simplicity of accessing the various medical and care expense deductions that you can do on your income taxes. In the realm of social and community care, a lot of we in this bucket we've parked a lot of financial and pocketbook issues. About a quarter of caregivers tell us that they're out of pocket about $1,000 a month because of their care responsibilities, and 1 in 5 caregivers lives on less than $20,000 a year. So this is real money, and for a lot of people, their care responsibilities through one path or another put them in a more precarious financial situation. So how do we address that? For starters, the other big thing we've been beating the drum on from the very beginning is the need to convert the Canada Caregiver Credit from a non-refundable credit to a refundable credit that would actually put real money in the pockets of caregivers when they file their taxes. This is a long-standing commitment from the federal government back to 2021, just hasn't happened yet. Even if implemented the way that they've committed, it's only about $1,250 a year, which isn't a lot. It's about $100 a month. But if you're one of those caregivers really living on the edge, even that extra $100 a month is a little bit more flexibility and a little bit more freedom in your life. In addition to that, we're putting in the window this idea of caregiver benefit in the style of our friends in the UK, Australia, New Zealand, where they actually provide financial supports every month to the tune of about $600 a month to people who provide high intensity care and work less as a result of that. We've talked about loneliness and isolation among caregivers. And as a sidebar to all of this as well, we know that there's a large and growing problem around helping military and veteran families and caregivers be able to support the people that they love, either in the forces or formerly in the forces, and also at the same time, in doing that, support our members of the Canadian Armed Forces to do their critical work. We know we need more of them, not fewer of them, and we hear loud and clear from this community that we need some supports around them to make this care possible. Now, very, very quickly, we've been looking around work and education. Various things that can be done to make it easier to balance work and care and education and care, but also to not punish you well into your retirement years through CPP calculations for taking time out of the workforce in order to provide care for somebody that you love. So here are a few of those ideas that we've been working on. And lastly, around the care workforce, the most important thing here is to respect those care providers who do this important work in every part of the country, starting with the basic commitment of a living wage of a minimum of $25 an hour. There's a lot more I could talk to you about, and I'm sure we've missed a bunch of things. We are on the cusp of releasing our national caregiving strategy in just about 6 weeks' time from now. So my hair is a little grayer than usual as we reach the landing that plane. And I did not share with you all of the stuff that's in there, frankly, in part because we are trying to keep this a little bit confidential so we can have a big bang when we launch in February. So I hope this has piqued your interest. And if you'd like to hear more, please be in touch and watch us as we release our strategy formally in and around the middle of February. So watch this space for that. Thanks, everyone. And I'll turn it back to Stacy for questions.
Wonderful. Thank you, James.
Thank you.
That's a lot of information in a short amount of time. So let's jump to some questions because the chat box seems to be blowing up a little bit here. So we have a question from Lisa Dawson. I've read studies regarding number of hours and money value caregivers provide, but are not paid. There is even further research which shows the value of engaging caregivers in all aspects, home, community, long-term care, as part of the care team. Given the lack of human resources these days, why has our country not thrown a money bone incentive or reward to caregivers who often must quit their jobs and compromise their health and lifestyle to be able to supplement our public care system. We can't grow enough healthcare workers to fill the widening gap we have.
Yeah, this is the billion-dollar question that we tackle every day here at CCCE, and I will restrain myself from opining at great length about why we haven't done this yet, but I'll offer two, I think, three specific reasons. Number one, this work is dramatically undervalued. And it's just expected that when somebody is in distress, somebody will look after them. Now, historically, that's been women, and historically, that's been women who end up taking the brunt of the care work on a regular basis, not just once, but over and over and over and over again over a person's life. That takes a toll, both on their health, their mental health, but also on their pocketbook from not being able to work to their full economic potential, which, as I said earlier, has an impact on all of us, where we're leaving value on the table for want of perfectly otherwise able-bodied, educated, human capital rich people working less than they otherwise would because of policy that forces them to for lack of support for the person that they love. So the undervaluing is one part of it. The other part of it is we live, and I don't need to tell you folks here, given the work that you do, we live in a very complicated regulatory and implementation environment around healthcare, where you've got a role for the feds around funding and setting big policy direction and buying change. And then in every province and territory, you've got a provincial, less territorial, but certainly a provincial approach to healthcare that may vary dramatically from one side of a provincial border to another. And then in many provinces in the Federation, you go one level deeper and you've got regional level implementation of healthcare that can vary dramatically from one part of the province to another. The effect of that is that things that are less nuts and bolts, so things that are, for example, that don't fall into the category of MRI machines and number of primary care visits and stuff like that, things that aren't as nuts and bolts and tangible like that, it is so easy for that to just fall through the cracks because that hasn't been provided for historically. And because it hasn't been provided for historically, we haven't yet figured out how to implement this all the way down from that big picture policy federal perspective all the way down to that local healthcare delivery and integration perspective. So that's the second part of it. We live in a complicated environment around this stuff. When you look at our friends across the pond in the UK, for example, they're at least a generation ahead of us when it comes to a lot of this stuff, in part because of the design of the NHS. Third thing I'll say here is a lot of this is healthcare, but it's not all healthcare. A lot of this lives outside of healthcare, whether it's disability supports, social services, mental health, and addiction services that aren't necessarily clinical, but more wraparound and community-based and stuff like that. And one of the Achilles heels in Canadian public policy is we haven't figured out how to click together healthcare and social care into one network. Nowhere in the country is this working properly. That's a whole other lecture we could have just on that. But that's one of those critical factors that we haven't figured out quite yet, which in part is contributing to why none of this has happened. And these are literally hundreds of billions of dollars that we are all being subject to because of this for want of insufficient support, both in terms of lost productivity, but also if you were to replace the care that caregivers provide with paid care, we're talking close to $100 billion every single year. So this is why I say that it's a bit of a ticking time bomb problem.
Thank you. How can technologies such as AI-driven platforms play a role in standardizing caregiver practices and improving outcomes across provinces? How does the National Caregiver Strategy prioritize caregiver mental health and well-being, particularly in preventing burnout? Are there any plans to fund or support initiatives like mentorship programs or peer support groups for caregivers?
I'll answer the second part of that question first. One of the ideas we're putting in the window is to develop a standalone, separately funded caregiver mental health fund. In the way that we've seen population-specific mental health interventions crop up over the last few years around Indigenous, around youth, around other subpopulations. It's time to apply that same logic to caregivers. There are a couple of specific things that caregivers need to see in their mental health supports in order for it to work. In part, we need that mental health care to be easy to access and quick. You cannot put a caregiver who needs mental health care in a situation where they're just on a wait list with everybody else, because that's how you end up exacerbating burnout and things that are already happening underneath the surface. If a caregiver puts up their hand and says, I know I need to provide care to my sick wife, but I'm nearing the end of my rope. I need help. If they put up their hand and say they need help, we need a system that's there to meet them in that moment, give them the help they need then, and put them on a path to better mental health and wellness, and ideally staving off and preventing burnout. But if that doesn't happen, addressing burnout over a longer period of time. But one of the features of our mental health system right now is it's all waitlist based. It's not like you put up your hand to say you need help, you're waiting at least a year, or you're paying dramatically high rates out of pocket for care, which caregivers really don't have that kind of money to burn on this. So we hear you loud and clear on mental health supports for caregivers, and our solution is this fund to fund truly high quality mental health interventions for caregivers. On the AI and technology front, I don't have much of an answer for you, because actually I skew in the other direction, that rather than standardization, part of this is recognizing the unique needs of the individual person receiving care and making sure that they have around them the support network that they need to thrive to their best ability. There is some standardization to do around training for caregivers and getting caregivers used to and properly trained up on some of the stuff that they're going to encounter over the course of their care experience. And I'm not sure there's much of a role for AI in that. Maybe we're talking about diagnostic stuff, sure, but in terms of the care world generally, from my perspective, this is a job for humans rather than a job for robots.
Has there been any thought to the caregivers of parents whose children do not take the equal responsibility of care? Question from Monica.
Yeah, the reality of far too many care experiences is that it falls on one or two people, often a woman, to do the heavy lifting for a person who needs care, even if there's lots of other people around them in the family or in the care network. I feel very strongly that the care that we receive as Canadians shouldn't be determined by our relationships. It shouldn't be determined by whether we're the friendliest person on the block or the person that everybody loves and who everybody wants to have a chit chat to. That's why we need to build systems. And these systems that we're trying to build are there to address exactly these kinds of situations where somebody might need help. Maybe there's one person taking on way too much work and driving themselves crazy doing all that work without a lot of support. Well, the ideal system that we're working on will meet that person and the recipient of care to provide them the backup that they need. So this happens, frankly, in my own family, where I'm a caregiver to my grandmother. She's called me twice while we've been on the webinar here. So I'll call her back when we're done. And the care is disproportionately skewed toward one person, even though there's a wider network of people around who could be helping. That's kind of the human experience in this regard.
Thanks, James. And we have time for one more question. To quote Andrew Picard, the fundamental question to ask is as follows: do we value seniors and or anyone who requires caregiving? Sorry, I need to bring it back up here. Sorry about that. If the answer is no, then the rest is a moot point. If yes, own opinion, to what degree? This degree of value and importance would then equal the value, input, policies, financial, and implementation. It is not high profile, expensive at the start, saves money at the macro level. Long-term struggle and commitment with champions are required. Comments? I'll just hear your comments.
Yeah, I'll just say to that, we've come a long way. In part because of organizations like Family Caregivers of BC and many others who've been fighting this fight. The public conversation around caregiving today is dramatically different from the conversation as it was 5 years ago, or 10 years ago when I was in government here in Ontario. Uh, the part of this is work on the part of organizations. Part of this is demographics. Demographics don't lie. The numbers are ticking up. I can say with absolute certainty that our elected officials are hearing this and listening, of all stripes and all persuasions. They're also living this. Like, it is shocking. I spend my days talking to elected officials, federal, provincial, of all political stripes. When I start into my spiel, far more of them than I expected when I first started doing this actually say, "Hold on, James, I get it. That's me, or that's my mom, or that's my brother, or my sister, or my neighbor, or it was my mom when my dad was still alive," and stuff like that. So we're getting there. I am an optimist by nature. Public policy is all about optimism because that's how we solve problems together. I wouldn't be as optimistic if I hadn't seen the public conversation already shift so much in so short a time. So more of things like this, more awareness building, more policy work, answering those questions, answering the door when a candidate comes to your door as they're about to do in a federal election and says to you, "Stacey, what do you want to see from my political party?" If all of us were to say, we need concrete answers on supporting caregivers, if we reach a critical mass of that, and that's the kind of thing you're going to see coming out of us over the next few months, that's how you move the needle on these issues, and we're committed to work hard towards that.
Wonderful. Well, thank you, James, so much for your time and, just bringing awareness and bringing us out of our silos and convening us for a better future for caregivers and those working in the field as well. We're at time, everyone. We have recorded this webinar, which we will be following up with the recording as well as an evaluation for questions. So we thank you all for investing your time here today. And thank you, James, so much for such impactful work that you do and just really, really bringing awareness and education to us all.
Thank you, everybody. Take care.
Thank you.